Good afternoon. Good morning, wherever you are. Good afternoon. I am Dr. Renee, and I have my lovely friend and sister, Dr. Kelly.
Hi,
And
everyone.
we are here to give yet another update to COVID-19, to calm everyone, give you the latest information. Information is power. Too much information is not a good thing, and wrong information is even far worse. So we want to give you right information. We're going to talk about any new ways they found to protect yourself, any new symptoms. I just want to make sure everyone knows exactly what to do and what not to do, because we really want to get rid of this as soon as possible. So, first of all, I'm Dr. Renee. I'm a medical doctor. I don't practice medicine the traditional way. I practice by giving you information about health and wellness in medicine. So, for those that are watching me on YouTube, in case you've never seen me or my show before, hi, this is me. And Dr. Kelly will introduce herself. She is an amazing human being in her own right. So introduce herself, and you can follow her on her stuff too. So we're going to keep this probably really short, but we want to just make sure we get you the information and get you in, get you out.
So I'm Dr. Kelly. I'm a board certified endocrinologist. So I treat patients who have diabetes and other hormonal conditions. And I'm really happy to be on today with Dr. Renee, just to give you guys an update. It's been a tough couple of weeks for all of us. This last week, cases of coronavirus or COVID-19 have risen exponentially. So we want to just come on to share some information. So I have an update on the new numbers. I'll just share that. According to the CDC, and I'm looking at it right now, there are about 10,442 cases. And I think when we did this about 2 weeks ago, it was perhaps under 200 cases. And the total deaths so far is 150. And right now, I think all of the states are reporting individuals being infected.
Yeah, so I actually sent the numbers to you last night. Let me find it for my lovely state and city. We have, as of last night, it was 422 cases in the state of Illinois. There was 132 new cases yesterday, and we had 3 new deaths yesterday. So we had our first death on Wednesday, and then yesterday there was 3 more. So there's 4 deaths so far in Illinois from COVID-19. So one wonderful thing, the governor of Florida has shut down the beaches.
Praise God.
Praise God. Because if anyone saw the videos and the pictures of all those kids basically celebrating spring break, it was just a bad idea. Bad idea. There is a meme going around, and I wholeheartedly believe this meme, and I really wish that people would take heed to it. But did I send you that one? I can't remember.
That.
It says, and it is so true, if you remember being a kid, then you completely will understand this. It says that if you hold on, can you all please just follow the government instructions so we can knock this COVID-19 out and be done? I feel like a kindergartner that keeps losing more recess time because 1 or 2 kids can't follow directions. That is so true. Remember when you were a child and the whole class had to do it right, or else the teacher was like, never mind. Please, if we can all just sit still for, if it is 30 days, then it's 30 days. But if we can sit still for 30 days, just look at the outcome on the other end is that we will have our summer. Otherwise, summer will be canceled. And when I say summer will be canceled, there will not be not nary event to go to, not a festival, not a concert, nothing. So for my event planner friends, I'm sure they would like it too. Please, let's just sit still. If you have, only essential trips to the grocery store. Go to the grocery store. You got to go to the bank, go to the bank. What is the third thing they said will be open? The grocery store, the bank, and the...
I guess the pharmacies, the hospitals will definitely be still open. Yeah. And, I've been seeing a lot of patients who have diabetes, and this week I've been telling them, cancel all your non-essential doctor visits. If it's a routine appointment and you really don't have to go, just don't go. A lot of hospitals and clinics are now exploring telehealth or telemedicine options, so that if you can have a visit with your doctor over your phone or or your iPad, you can do that, but just don't leave home and if you don't have to. And if you are someone that's on insulin or on medications, make sure that you have enough medication to at least last you for a month so that you don't have to leave home unnecessarily.
Definitely. If you have questions, please post them and I will try to address them. But the other thing is I saw a post yesterday. There was someone who I guess was visiting who now can't go home and they're on insulin. What do they do? And so I said, most of the pharmacies are linked across the country. So if they go to one of the larger pharmacies, then they should be okay. The other thing was that this person is on some government assistance as far as getting their medicines paid for.
Mm-hmm.
But like I said, if they're on the same, if they're at a CVS, Rite Aid, whatever, if you go to that, wherever you're at, they should still be able to communicate with the one with the same system. Secondly, if it is a mom and pop, then have the doctor's office call and talk to them, and you should be able to get the medications without any problems. But unless you absolutely have to, please do not go to the doctor. The very best thing, if you have any signs and symptoms, and I actually had a graphic that I posted this morning. And I already knew I did something wrong. I forgot something. Here's a graphic I posted this morning. So these are the symptoms, some of the symptoms of coronavirus: fever, dry cough, fatigue, phlegm, shortness of breath, muscle or joint pain, sore throat, headache, chills, vomiting, stuffed nose, diarrhea. So those are the signs and symptoms. If you have any of these things and you're concerned that you might have coronavirus, COVID-19, call the doctor first. Do not move. Call the doctor first. I have, and maybe I'll post her video, a family friend who she actually is herself a doctor, but she wasn't feeling well. She has asthma and knew she was having asthma problems, but knew that it could possibly be that as well. So she called her doctor. And she sat in the car. They called her and told her, now is your turn. She came in. They had her come in a back door and they had her go right into the room. She did not sit in an area with other people. So therefore, she didn't infect anyone. They didn't infect her. I believe they gave her a mask. Like I said, she is a doctor who actually does practice in a clinic. So she might have had her own masks and put a mask on and went in. And then she is being tested because she does work around patients. So she had to go someplace else for the testing. Same procedure. Sat in her car. They would call her and tell her when it was time for her test. And then she would leave her car and go for a test. So this is all just to tell you that, this is not a game. Just make sure that you call ahead of time. Unfortunately, I just read in Pennsylvania, like half of their cases are doctors that have died. So, we want to be there to help you, but we can't be there to help you if you keep getting sick. So
no, not only that, today I was in a grocery store and I saw I saw someone else coming into the grocery store with the N95 mask. And I'm like, there are doctors who are actually treating patients with COVID-19 or seeing patients suspected or having these symptoms and they don't have the right equipment. So why are you wearing something that's such a precious commodity right now to the grocery store? When I got to the grocery store, they give you the hand wipes to like write down the shopping cart. They had literally just put one out and somebody took it out. Someone's like literally stole it from the grocery store. Like, stop doing. Yes, it was gone. It was gone. So I had to beg one of the workers to like spray some on like a tissue for me to wipe down the thing. So like, be mindful, be more considerate of other human beings. Like, you're not the only one who's anxious. You're not the only one who's scared. Not the only one who has family. Like, these physicians and nurses are out there and they have to go home to their own families. So just be a more considerate human being.
Kelly does such a good job with this, but I always forget. Please like and share this. Please like and share this. I appreciate it. We hit 4,000 likes the other day on my page, which was awesome, and I appreciate you. But this is great information that I think that people need. There has been so many strange things. I tagged Kelly this morning on something that was a little odd about the blow dryer. Did you see?
Let's talk about that.
Okay. So there's a video, And the video states that it's from an organization whose acronym is WHO, but it is not the World Health Organization putting this video out. But it's something where they're saying basically that if you you can blow the blow dryer through your sinuses and somehow cook COVID-19 until it's gone. You guys, that is not true.
Not only that, if you put heat to your nose, you are going to damage your mucosal membrane in your nose and your small airways, which are actually a protective barrier from infection. So if you do that, you are probably going to increase your risk of having COVID-19. I've also seen another video talking about, or some meme talking about, if you drink lots of water and keep your throat moist at all times, you're also not going to get it. Not true. The things that you should do: wash your hands, avoid crowds, practice that social distancing as much as you can. It's not always possible, but as much as you can, stay 6 feet away from other people. Like I realized this week that I touch so many surfaces, like to turn the light on, to open a door. Now I use the tissue. Before I open any door, I use a tissue so that I'm not touching stuff, because the virus can actually live on surfaces. It likes metal, it likes plastic apparently, more than even like cardboard. So you just got to be careful and mindful. Like, you know, I realize that I touch my face a lot, but no, I don't, because I'm like, not until I have my hands sanitized, I'm not touching my face.
Yes, and I know I touch mine a lot too, but I'm here by myself. So
yeah, you're good.
And no one has come in here in a really long time. So therefore, look, ain't nothing in here but me. And then the other thing is, you know, people think we're kidding. They think that doctors, and this is what really made me mad. So there is, and actually you can look here on Ask Dr. Renee, there's a video that Don Lemon and CNN put together of all these things that man in the house, he said that don't make any sense, and show that he knew about this and that he could have protected us and we wouldn't be in this situation. But that video, I had it on my personal page. Well, comments were coming, and some of them I didn't like. And so it's my personal page. And so I told people it probably was not going to be there long, and it wasn't. I deleted it before the night was over. I deleted it because a whole conversation started about doctors saying that all we can do is wash our hands. You guys, all we can do is wash our hands. You don't understand how powerful hand washing is, and I'm going to tell you really soon. I'm just waiting to get this video done. But I am going to show you how powerful washing your hands is, how powerful just that act is with soap and water. If you watched the video that we did, Dr. Cindy and I did the other day, I don't even remember the day, the days are blurring, but just this week, Dr. Cindy and I did a video. She got very technical with it and talked about the hydrophobic and the hydrophilic cells, parts of the cell. And I don't want to get you, because I don't want you to miss the point. I just want you to understand that soap will break down the virus if it is on your hands, and you won't have it on your hands, which means you wouldn't be able to spread it anywhere else. As far as we still know, it is respiratory droplets. Yes, they could be airborne, which is why the 6 feet distancing is so important, which is why it is so important to sneeze into your elbow, which is why it is so important to cough into your elbow, which is why it is so important if you cough or sneeze with a tissue, you throw it away, which is why do not use handkerchiefs anymore. All of that. This is why all of that makes sense. This is exactly why that makes sense, because we need to stop the spread. Now, somebody else was like, well, people like, oh, well, if we need, what is the purpose of us being locked up for 30 days, 2 weeks, whatever? The purpose is simple math. And now that a lot of you are homeschooling, perhaps you will learn this, or you'll teach this to your children. But if we have 100 people that have the virus on day one, and if the virus in 14 days is supposed to go away, and we don't let those 100 people come in contact with anyone else in those 14 days, what will happen? There will be nothing, right? So that is what we're talking about with flattening the curve. Instead of the curve getting large, the bell of the curve getting larger and larger and larger, we need to flatten the curve, because honestly, the truth is that the hospitals in the United States of America can't handle all these sick people. They just cannot. It is not possible. So because of that, we need to really try and do the best we can to adhere to the social distancing, to wash your hands at all times, carry hand sanitizer. I know sanitizer is becoming quite a hot commodity. I have a friend that actually makes and sells sanitizer, and I will have the link for you very shortly. And we will, because I think she's about to sell out, unfortunately, again, but I think she's making and making and making. But if you want to make it at home yourself, you have to have at least 60% alcohol. That is the one key thing for it to be effective. It needs at least 60% alcohol. And I'll try and find a recipe to post as well if you do want to try and make your own. But it is so important. This hand washing is not a game. So when I have to go to the grocery store because, like I said, it's just me. I went to the grocery store yesterday. I went to 2 grocery stores yesterday because things were running out. And I literally came home, washed my hands, and I took off my clothes, and that was that.
Yeah, and the sad thing is that, you talked about the curve. Like, we are still on the upswing. We have not even gotten to the top of that bell curve yet. So that scares me. Also, like, hospitals have been postponing non-urgent or non-emergent surgeries, but there are patients who actually still need those surgeries, like someone who has breast cancer. Imagine you being told that your removal of your cancer is non-emergent, so you have to wait for 3 months. You know what I mean? But we have to do this because we don't want to overwhelm our healthcare system. So please don't get sick because there are other patients who generally have stuff that needs to be taken care of that we just can't right now.
Yeah. So you need to do whatever it is you do to stay well. You need to, take your vitamins, eat right, exercise. You can go outside. Just don't.
That's why I'm dressed like this, because I'm going to go for a hike in a few hours.
Yeah, just don't go outside in a group of people. But you could take a walk. And just be very smart. Let's just be smart about what we do, because the numbers that we have are very comparable to Italy. And that's not good, because things in Italy still haven't slowed down. And so we want to be, in China, they're done. Yesterday, I think, was the first day there was 0 new cases. China, the stores have opened back up. Everything is going, back to business as usual in China. So China, the first case, I think, was Thanksgiving time. And now look what month it is. So we hopefully don't need to go that long. Hopefully we can go less than that if we all could just sit tight. Now, I know the Chicago public schools are out until April 20th. And I know that the state of California has completely shut down. They are shelter in place for the entire state. And I think a lot of other states are going to start moving that way. So just, now that you all have bought all the toilet tissue that's known to man, I think you should have plenty of toilet tissue. Now other people can go and they can get what they need. Because like I said, this week I was able to find toilet tissue in this grocery store. I was like, okay, I should not have to come back to the grocery store for a while. I just got an email from DoorDash saying that they're not going to have any in-person contact when they deliver your food. So I'm not sure. I didn't read the whole thing yet. I had to come on, but there's something there. I'm not sure how they're going to run it, but they have something, some new system to make sure that they get you your food when you order. But let's try and figure out how we can help to not spread it. So there are people who did decide to go to Florida still. And, there was a ton of people on those beaches. If you saw the videos and the pictures, those people need to go home and sit still by themselves for 2 weeks before they expose anybody else. Because that was a cesspool of God only knows what, besides COVID-19, a whole lot of other things too, I'm sure. So those people need to self-quarantine themselves, because you're going to spread it, and we don't need it to spread any further. Today I read this morning that there was a man that's worked for NBC for years who died. And he got exposed, and he was positive, and he died. And so we need to just really make sure that we follow every precaution we can. Kelly is on the front lines because she does still have to see patients. Diabetes is one of the comorbidities to COVID-19. If one of her patients is to get COVID-19, they might not make it. So she has to see her patients. The patients she doesn't have to see, she has been making sure they don't come. But the ones she has to see, she has to see. But she doesn't even have an N95 mask. So can we please make sure that the people who need the resources get the resources that they need? There are so many people that are testing COVID-19 people that don't have N95 masks. don't even have face shields. So if the person coughs on them, respiratory droplets are in their eyeballs. It's just not fair. It's really unfair how the healthcare workers are having to work right now. And they're all doing this in the name of saving your life, and which might actually impinge on theirs. Like I said, there are several healthcare workers that have died. So let's, just be very thankful to those that have to continue to work and have to work in really bad situations like hospitals. New York, is the state in the country that has the largest number of cases. And I do think the governor of New York should probably be the president of the United States, but he is really handling things very well. And he is really doing his best to get it under control as best as he knows how. I really commend the governor of California for shutting down. That's a large state too. And that's a whole lot of people that could have been. And I guess maybe he didn't want to look like New York. So therefore he just shut it down now, which, like I said, it's frustrating. It's inconvenient. It's all sorts of things, but it is what it is. And we just have to do what we have to do.
I've heard people say, you know what, like 80% of cases will recover. And that's true. And I looked at the potential death rate from COVID-19 coming out of data they got from China. And what they showed was that the overall death rate was, I think, about 2.4%. But when you broke it down according to age, if you were over the age of 80, your risk of dying from this was like almost 15%. The rate is under 1% if you're 50 years or older. Then when they also broke it down in terms of like of comorbidities, like if you have hypertension or heart disease. So the death rate among patients with hypertension heart disease was about maybe 7%. If you had diabetes, it was about 6.3%. Chronic lung disease. So there's so many patients out there. There are 32 million diabetics in the US. So there's so many people out there who, unlike you, who are healthy, who might not recover.
Right, exactly. And so when we say, you might have it and don't know you have it, but don't go expose somebody else who can't fight it. That's the thing. So, the one thing I will say, I just was watching Paul Carrick Brunson's Facebook Live, and he had a Jamaican woman on, and she said Jamaica is adhering to the social distancing. And so I hate to say it, but this is the difference between certain people and certain people. Come on, America, let's all work together. And let's think about the next person and not ourselves first. So I'm
from Barbados. And like, if you travel out of the country, when you come back, you are under mandatory 14-day self-quarantine. If you go out of the country, especially the US, if you come back, you got to go home. So we need to start doing some of those measures as well.
Yeah. And so I could, because I can work from anywhere, I could go home and sit with my parents, but me just getting there would expose me to God knows how many people, and then to take it home to them. And, as young as they look, they are not, they are senior citizens. So it's just best that I just stay here by myself, which is okay. And, and whatever bugs, if there's a bug on me, it stays with me. The other thing, and I will do a video about this as well, I have asthma. So really, I do have a comorbidity. Thankfully, my asthma is low. But if I had any signs of, oh my God, and I started having issues, I know what to do. I'd call the doctor and I would follow the same steps that I keep telling you guys to do. Thankfully, like I said, my asthma is still just exactly where it was, 2 years ago. It's just the same place. I'm fine. My breathing is fine. I'm not having any issues. So, but you have to we just have to remember that people, unfortunately, they just have to sit still. We just have to. There's no choice. Thankfully, a lot of things are shutting down, so it's requiring people to sit down. I did a video this morning with links that have links to different resources. I have a link to free exercises online, the YMCA. I have a link to be able to watch the latest movies that were supposed to come out in the theaters. They're streaming them for you online. Netflix is a Netflix parties. I forgot I'll put that link up too. There's so many amazing things. Royale Watkins is on, and I was going to send him a text, but I'm just going to publicly say that Royale is one of the funniest human beings I know on the planet, and I will be the first to tell you, and he'll tell you, I've said it before, I'm really not the biggest fan of stand-up, but ask Royale how many shows I've been to, especially of his. So, Royale, you should do a live stand-up show. If you could get some of your guys, that would be awesome. DJ D Nice, who me and Royale are very cool with, he did a 9-hour, I think they said, set the other day, but he's going to be on today. I think it's 3:00 Eastern Standard Time, and his name is D Nice on Instagram. He's going to do an Instagram live, and he's just going to DJ. It's just like a dance party. John Legend did a concert the other night. Erykah Badu, I think, is doing a concert tomorrow night. One of my former clients, I suggested he do a concert, so hopefully he will, and I will announce it when he says he's going to. But yeah, there's, we can all entertain and have a good time together. I just heard about people having dates via FaceTime and Zoom. So look, Kelly, maybe we'll get more action that way, right? But there's all these different ways to utilize the time, and to pass the time, because yes, I know it's really crazy, but at least there's things we can do. We can listen to podcasts. You guys can watch my channel and give me those viewing minutes, which are going really great too. Thank you. But we need to just figure out what we can do to make sure we don't spread it. That's the biggest thing. Let's just not share it with everybody else. If you got, like Idris Elba, he said he knew he was exposed. They told him he was exposed. So then he sat tight in his house and was like, I'm not going to spread this to anyone else. That's what you need to do. That is what we need to do. So can we all just work together to do that, so that we don't have to lose any more recess, because we fight so long and so hard in Chicago with this weather that we have to be able to enjoy the summer. So please let us be able to do that, or else, look, I'm going to leave the country because I can't do it. I can't with you guys. So please, let's flatten the curve. That's what we need to, maybe we should start doing the hashtag flatten the curve. We need to flatten the curve. Also, the masks. Like I said, the people who need the disposable masks, the N95 masks, are those that are in the hospital. If you are sick, you need to stay at home. So if I go to the grocery store and you have a mask on your face, you're sick and you should be at home, not exposing all of us to it. So you don't need to wear masks. You don't need gloves. The doctors in the hospitals, the doctors in their offices, they need gloves. They need gloves. They need face shields. They need masks of every kind. We civilians don't need that stuff. The only people who need that stuff are people who are sick. And if you're sick, you're putting it on because you're about to walk into the doctor's office or the hospital. And actually, they'll probably hand you one to put on. Please don't use resources that we don't have. We don't have them, so don't use them. There was a lady yesterday in front of me at the grocery store who had on gloves and a mask. And clearly she had been doing this because there was plastic on her forehead. So therefore, you got a mask on and you touching your face and you got gloves on, ma'am, you're just spreading this everywhere. I was like, let me get the hell out of this darn grocery store as soon as possible, because she is passing the heebie-jeebies all over the place. So if we can, like she said, sanitize your cart, sanitize your hands. I told you there is a sanitizer as soon as you get off the elevator. When I leave, when I walk back in, I put some sanitizer on before I get the elevator. I hit the elevator with my elbow, and I hit the button with my elbow, and I go home. And I am the only human being touching my door and everything, because it's just me. So and I wash my hands as soon as I get in too. So wash your hands, 20 seconds, wash your hands. I think that one thing we're going to learn out of this, we're going to learn how to properly wash our hands. The other lesson that I think we've learned is that people don't wash their hands correctly, because that is one of the ways that this has really gotten out of control. The other thing is, your mother always told you to cover your mouth when you're coughing. And a lot of people haven't been doing that, clearly, because, like I said, it's been spreading. I just saw at that Millennium Tour with Bow Wow and Omarion and all those people in Wake County, I think it was one of the Carolinas, somebody was found positive. And see, that's that non-social distancing people were doing. And somebody probably coughed, sneezed, or something. So that's what I'm saying. Please, 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 please practice social distancing. Just about everything has been canceled anyway. So in the U.S., you can't go to anything. There's no basketball games. There's no the baseball season. I mean, all of this stuff is, put on hold or canceled. So you can't go. So just don't. Just sit tight. Church. I love the Lord. Kelly loves the Lord. My mother's a priest. But right now, we need to watch church on TV or on the internet. We do not need to be sitting in church, because there's another cesspool of, I hate to say, but an elderly population of people that are going to be exposed to those germs. So let's just stay at home. And if your church isn't online, I got $10. You'll find at least 5 that are. and every day of the week. So, and you can do Bible study via Zoom as well. So if you want to learn about these different technologies, ask someone, send me a message. I'll tell you all about it. But there's got to be a way that we stop this. And I just for the sake of everyone's sanity, I need us to stop, to just get this under control, because my friends, a lot of my friends, for obvious reasons, are physicians, and they are going out of their minds because the patient load is just ridiculous. It's through the roof because so many people are scared, and then so many people are coming down with symptoms. So between the two, so if you can just, calm down and just really check, am I really sick? Call first, use telemedicine, stay at home, save yourself some money because you might not actually be sick, and then that could save you some money. So, Kelly, is there anything else you wanted to add?
I think we kind of covered it all. This was the first week as a physician where I was literally afraid to go to work. So I know this is affecting all of our mental health. Even not only us physicians, but you just staying home for 2 weeks with your children for the first time is going to affect everybody's mental health. So do things to protect your mind, like meditation, continue to pray, do your journaling, make sure you still exercise. Don't be stuck in your house the entire day. If you are well, go for a little walk. Just do whatever you can to remain sane. We want you to take this seriously, but we don't want to throw anyone into a state of panic or for us to be living in fear.
Exactly. So you can follow me everywhere at Ask Dr. Renee. I'm on Twitter, Facebook, Instagram, Pinterest, and of course my YouTube channel. Hi to my YouTube friends that are watching right now. And Dr. Kelly, you can follow her everywhere
at Dr. Kelly Wood, MD. That's DrKellyWood, MD.
And Dr. Kelly, if you're watching on YouTube, all of her stuff is in the box below. And if you're watching on Facebook, I tagged her page.
Thank you.
In the description. So you can definitely find all of her stuff there. Go to her fabulous website. She has a wonderful book called The Bounce Back. You can check that out while you're sitting at home. You can order the book and read the book. It's on an ebook too, right?
Yes.
Yeah.
So on Amazon, yeah.
Yep, on Amazon. So check out her book, and we'll talk to you guys later. Bye.